Welcome back, friends. Let's begin our lower limb. So in our live class we have already seen the osteology of ilium, that is the upper part of the hip bone. Now we'll do the lower part, and in this session I am doing the ischium. So let us learn about this in detail now. As I always tell you, osteology is very important. It forms the basis for your learning, and osteology is like a brick in the house. If you know the osteology better, you will know the rest of the anatomy of this particular region better. So I recommend every day you look at the osteology of these bones on a daily basis so that you remember it better. So now we have already seen part of the bone here we are doing. If you look at the, if I bring the picture back, okay, so yeah, so if you remember, this is our ilium. We have already done the ilium, and this is located superiorly. This is superior bone, superior flat bone, whereas this is the blue bone is the ischium, which is inferior. You can see this portion, it is down inferior, but it is behind. So this is posterior and this is anterior, and this bone is also down. So antero-inferior is your pubis and postero-inferior is the ischium. So we are doing ischium. Now what exactly is ischium? Ischium is literally means a seat bone. That's exactly the meaning of your ischium, literal meaning of this in the Greek. And if you look at this, there's the bone. If you notice this, you can see in this diagram, you can see this is the bone on which we are actually sitting. So they are also called as commonly as a sitting bone, right and left, the blue colored area through which, so in standing, our entire body weight goes through our foot to the floor, whereas in sitting, the body weight reaches the floor or the chair through our ischial bone. So this is the sitting bone, right? So literal meaning of ischium is seat bone. Now, as I already told you in this picture, ischium is a postero-inferior bone. So what is a ischium? It is a part of a bone. And which part of a bone it is? It is postero-inferior part of a bone, where antero-inferior is your pubis. And this part of the bone has got parts are there of this bone. So let us bring the picture here. Okay, so this is the lateral view we are seeing. And this, what are the parts of ischium? The parts of ischium are, the ischium has got two parts. They are body of ischium and ramus of ischium. Now body of ischium, where is the body and where is the ramus in this picture what we are seeing? So the body, the ramus is very small part. So I can show you the ramus, rest of the part, whatever we are seeing is. So this extension what you are seeing, which I am drawing in the figure, is extension what you are seeing, this portion. This extension is what we call as a ramus. Now if I use a different color, the rest of the part, so this rest of the part, entire part, whatever is blue in color, which I am drawing now, so whichever drawing with the red color pen now, this entire portion you can call this one as a body. So this entire portion is your body. The red margin portion is the body, the black margin portion is your ramus. So this is the entire, so two parts are there. So now let us see again what is the body is all about. So now the body is again has got, first we'll do the body and then we'll go to the ramus. So body is about, so body has got various parts now. So what are the subdivision of the body? Body has got ends, it has got borders, and it has got surfaces. Now we'll see one by one. So first, what are the ends of this? So how many ends the body has got? So we'll start with this. I'll list down here and then we'll go one by one. So body has got two ends, an upper end and a lower end. And borders, it has got three borders. They are anterior border, posterior border, and your lateral border. It has got three surfaces. They are femoral surface also called lateral surface, dorsal surface also called posterior surface, pelvic surface also called medial surface. So these are three surfaces, three borders and two ends. So in this diagram, let us see what I can show you about the end. As far as the ends are concerned, so I'll mark with the black pen only. The end is upper end. So upper end and the lower end. So how do we demarcate the upper end and lower end? So here upper end is the part which is taking part in the formation of acetabulum. So this portion, so what I will do is I will shade the part of upper end. This all is your upper end. This entire part you can call this portion as upper end. This is your upper end. So this part I can call this as a upper end of ischium. Whereas whatever part, the remaining part which is left out now, which I can share it with your entire color with the blue. Now this portion you can call this as a lower end. So upper end is smaller part which is contributing to the, so upper end again you can say upper end can be divided again into your anterior part. So this is anterior part which is again taking part in the formation of your acetabulum. So it forms how much part of the acetabulum? Just like your ilium is contributing 2/5, but this we call as a superior part of the, this will be postero-inferior part of the acetabulum, that is also, so it is red in color. If I draw, maybe it will be seen. This also from the postero-inferior 2/5 of your, or posterior part of the, postero-inferior part of the acetabulum is, again the contribution is 2/5 of this ischium. So this anterior part of the body, of the upper end of the body, is forming your acetabulum, whereas the posterior part, if you see, this is the part which is, again maybe I can use a different color to this. So possibly I'll use a green color. Now this portion, this entire part which is outside, and this portion is the posterior part of the upper end of the body. This part comes in contact with the, direct contact with the sciatic nerve. That's it. So the only relation here. So the anterior part of the upper end is forming the posterior-inferior 2/5 of the acetabulum, whereas the posterior part of the upper end is coming in contact with the sciatic nerve, because here is your greater sciatic notch. The sciatic nerve will come through this, it will lie on this part of it, and then it will go down towards your posterior aspect of your lower limb. So you can, if I draw the nerve in this, I can, so you can draw, this is, it is coming in contact with the sciatic nerve, this portion. So this is about your upper end of your body. Now what about the lower end? Now as far as the lower end is concerned, the remaining area I told you till here, this part, the remaining area, this is all we call as the lower end. Now lower end is actually contributing, you can see all this was here, you can see this is all was your upper end. Now the lower end is contributing, this entire part is what we call lower end. It continues as, or it forms, this is a thick area, what you can see, the entire thick area, rough area, it is looking very rough. If you can notice in the picture, this is what we call as your ischial tuberosity. So ischial tuberosity is an important question. So what is ischial tuberosity? It is the lower end of the body. We clear? So again upper end, so upper end is again divided into anterior part, the anterior part, and then the posterior part. So anterior part is forming the posterior-inferior part of the acetabulum. This is entire cup is called acetabulum, whereas the posterior part of the upper end is we also call it the dorsum of the posterior part. It is related to the sciatic nerve. Whereas the inferior part of the lower end, this is what we call as it is rough in its architecture. That is why it is called the tuberosity. Since it is a part of the ischium, it is called as the ischial tuberosity. So this is the part on which we exactly sit. So we are sitting on the ischium. Which part of the ischium we are sitting? We are sitting on the ischial tuberosity right now. So right now you're listening to this lecture and you're sitting on a chair, and right now you should be thankful to your right and left ischial tuberosity. So this is about your end. Now we have to look at the borders now. So there are three borders are there: anterior, posterior, and the lateral border. So this figure is already been occupied. So I'll take up another figure. I have to go a little more deeper. My kid yesterday has taken some photograph. That is why these images have gone a little back. Okay. So now we are looking at the, remember we are doing the body of ischium. Under body of ischium, we have already mentioned about the ends, which are again upper and lower end. And I told you lower end is nothing but our ischial tuberosity. Upper end, if you want to remember in word, just remember the upper end forms ostero-inferior 2/5 of acetabulum. That is as simple as in one line. Whereas the lower end is forming your ischial tuberosity. We'll come to this part in a while. Now let us finish the lower end. This part also it will get over. So ischial tuberosity, if you observe, so here we are doing this entire portion. Let me draw a margin. This entire thing, if you see, all of it can be called as a ischial tuberosity. It is like an oval in shape. Now this entire long piece of bone, rough bone, is lower end, is what's called ischial tuberosity. It is an important 3 or 5 marker. Now this is further divided. Remember, this is our anterior, this is posterior. So this is anterior. So this portion, this side will be your lateral, inside will be your medial. Okay. Now this entire oval shape area is divided into two parts by a transverse ridge. If you can make out, there is a transverse ridge which is separating the upper smooth part with the lower rough part. So there is a transverse ridge is present here. That is a transverse ridge which is dividing area into your upper area, and this one is your lower area. Now if you notice again, the upper area is further divided by an oblique ridge. See, the ridge is there. I am just putting a line here again. There is another line. So this I can call this as a, first was a transverse ridge dividing into upper and lower. There is a now oblique ridge. Another bony ridge is there in the upper area, which divide this area into, I told you this portion. One part is, this one is, here we will have sacrum, because this side, inner aspect of this will be a sacrum will be there. This is anterior, so this is posterior. So this is, here is the medial part. This is medial. Here this is inside. So this is medial. So this portion we can call this entire area as your posterior inferior. This is posterior. This is posterior. Wait, one second. What has happened? If in analytical position, you see this one is posterior, the lateral, this is inferior. Correct. This is M. This is down, because it will be, please remember, this is facing down and this is facing up. So thereby this area is your the area which is facing up. This is your little up. So superior lateral area, and this portion we call as a infero medial area. So we are doing the ischial tuberosity. Ischial tuberosity is divided by a transverse ridge into upper and lower half. Upper half is divided by an oblique ridge into a superolateral area and above, and an infero-medial area below. And the superolateral area above, this area is giving attachment to a muscle. Now this muscle, superolateral muscle, it gives an attachment to a muscle called semimembranosus. So here it gives attachment to a muscle. Now this muscle is called as semimembranosus. Here this all is a muscle. The entire area is giving attachment to a muscle. I'll show you these diagrams all. Semimembranosus. So semimembranosus is a muscle which is attached to the ischial tuberosity. Where in ischial tuberosity? In the upper part. Where in the upper part? In the superolateral part. Then in the infromedial part, here you have two muscles which are attached. So the muscle, two muscles are attached here. So one muscle I can say is semi-tendinosus. It is a half tendon. This one is half membrane. That is why semi-tendinous, semi-membranosus. And another part, another muscle what we have here is your long head of biceps femoris. The word femoris is important, otherwise it will become your upper limb muscle. So long head of biceps femoris. So you got now three muscles in this upper area: a lateral muscle, semi-membranosus, a medial two muscles, semi-tendinosus, and long head of biceps femoris. So this is confusing. You may remember the medial as membranosus and the lateral as tendinosus. The only easy way to remember is, so since this is membranosus, there is a membrane inside this. So membrane means something like a kite. So kite will fly away. That is why it is lying laterally. So whereas tendinosus means it is a tendon, so it is heavy. Also you also got one more muscle. So there are two muscles are there, so it will be heavy. So it is on the medial side, inner side, whereas it is on the lateral side. So this is your division of your membranosus and tendinosus. Clear? Okay. Next, the lower part, if you see, lower part again by a vertical line, it is again divided into a medial area and a lateral area. There is a problem here. The three-dimensional picture will be able to make out. I think again the lateral part, this is again I was correct only in the beginning. Inside portion is here, I think. So let me again redo this portion for you guys again. So again I'll do this part again, sorry. So this portion, let me do it again. Okay, so we are doing the ischial tuberosity, which is this entire portion is what we call as a ischial tuberosity. And this ischial tuberosity is these impressions and all what I have seen. With that I got confused, so we'll ignore that impression and follow what is given in the book. So thereby this is anterior, so this will be your lateral side, and this is posterior, and this inside will be medial side. That was what I told. And this entire area ischial tuberosity is divided by a transverse ridge. It is divided by a transverse ridge into, now this is correct, transverse ridge into an upper area and a lower area. So this is fine, there is no problem with this part of it. And then again there is a vertical ridge is there, which is dividing this into, now this portion which I told, now this one is what we should call as this one, superolateral area, whereas this one should be your inferomedial area. Here you cannot see inferior and superior because it is in a straight position, but if in an anatomical position it will be there. So this will be coming little down and this area will go little up, because this will be little upward there in order to match this. So thereby with that we will get this. Otherwise, at least the lateral part, if this is lateral and this is medial, that part is very clear. And there is a vertical line in the lower part which will divide this area, the lower area, into this one. Again we'll call this one as your lateral area, simply lateral area, and this one will be your medial area. So there are four areas in the ischial tuberosity by your three line. So first line will divide into upper and lower area, then the upper area is further divided by oblique line into your superolateral and infero medial, and the lower vertical ridge is dividing the lower area into your lateral area and a medial area. Now there are muscles which are attached to this. So what are the muscles? So the muscles are, so in your superolateral you got the muscle, a half membranous muscle, so that is your semi-membranosus muscle, semi-membranosus, it's the name of a muscle. Whereas your infromedial you got two muscle. So one muscle is your semi-tendinosus, Another muscle is your long head of biceps brachii, long head of biceps femoris. So this is your another muscle. Two muscles are there. In the lower area, when you go, it is again divided into a lateral half and a medial half. So as far as your lateral half is concerned, it will give a attachment to a muscle again. So this lateral half give attachment to muscle called as the name of the muscle is your adductor magnus. Adduction. So adductor, largest muscle. So magnanimous. So magnus. So adductor magnus is a muscle which attached to your lateral lower area of ischial tuberosity. Now you see there is a medial area is here. So this medial area is subcutaneous. So this medial area is subcutaneous. So if you remember, I told you we guys are sitting on our ischium. On the ischium, where we are sitting on ischial tuberosity. In the ischial tuberosity, on what we are sitting in the lower, this area. In the lower area where we are sitting on the lower medial area. So this subcutaneous area is the area where we are sitting. So this is the part. This is subcutaneous. And here it is separated from our skin. So sometime when we sit without any control over our knees and suddenly we bend, so that hurt what we feel in our bums is actually on this bone, because this bone comes in direct contact with the ground, or whenever we fall also, because of this we directly land on this particular part. So you can say here your medial portion of your lower part of ischial tuberosity is subcutaneous, and it is not directly coming in touch with the skin, but there is a bursa here. So there is a bursa here. So this is a bursa which is present between the skin and the bone. Now this bursa get inflamed in occupation. Inflammation gets swollen in occupation which involve lot of sitting. So what type of occupation which involve lot of sitting? Weavers. If you know what I am saying, weavers are the guy who weave your shawl, saris. You might have seen this Kanjipuram, or even if you go to Kashmir side, they make those shawl. They sit on the floor and they use this handloom. Yeah, so these are your handloom guys. Yes, these are your handloom guys, where they will sit on the floor and they weave the cloth. So the entire day they will sit on the floor and they keep weaving. So their profession involved continuous sitting. So that time what happens is this bursa, which is separating the skin and the bone, get inflamed. So that bursa will, now this bursa is called as a weaver's bursitis inflammation. So weaver's bursitis is the inflammation of this particular subcutaneous bursa. You clear? So this is about your lower end of the body of ischium. So upper end is acetabulum, lower end is ischial tuberosity. This is very important from your viva point of view. In your viva, what they will do, they'll mark this area with a chalk, and they will say identify the marked area, the area identified as ischial tuberosity, and write the muscles attached to it. So you can draw this diagram as simple as this. Just to put like this, some diagram like this. Then you divide this into upper and lower. This one further you divide. Sorry. So you can just make it this and divide this area. Lower part you can divide into medial and lateral. Upper half also you can divide into, you want supero, lateral and infromedial. So this way it will be easy, because this is superolateral, this is your infromedial, this one lateral, so this one will be your lateral half. This is medial, so this is your medial half. So infrolateral, superolateral is semi-membranosus, membrane. It can very easily fly. Whereas this one is your semi-tendinosus, along with the long head of biceps femoris. Then the lateral part is giving a attachment to your adductor magnus muscle. Medial part is subcutaneous, only it is related to a bursa. Yeah, so this is your very important 3-marker question from the viva and even from the spotter's point of view, and even can be asked even as a 3-marker in your university exam. Now we are done with the ends. So if you remember, here we are doing, I told you, in this we are doing the body. In the body we are done with the ends. In the ends we did the upper end forming acetabulum, lower end forming the ischial tuberosity. Now we go to the borders now. So let us talk about the borders. So again I'll bring the image. borders. We're doing the borders of body of ischium. These are the borders of body of ischium. See again, we are here doing body, under body we are doing ends, borders and surfaces. Now we are doing the border under body. So borders. So I said there are three borders are there. And what are the three borders I mentioned? So there is a anterior border. So in anatomical position, once you know to hold the bone in the anatomical position, then you will get all this border. Posterior border, and there is a lateral border. Now anterior border. So where is the anterior border in this figure? So anterior border is now in this anatomical position. So the anterior border. So this entire, now I am marking with the pen, this entire thing what you are seeing, because this one is your anterior and this is posterior, and this one inside will be inside. If it is this is medial, so outside this is your lateral. Okay, so now this border what I am marking now, all this border, so this border is the anterior border of your, so if I put a mark here so that I differentiate your body, this entire thing is, we call this as a body. Remember, the entire portion is your body. So in this again, if you use a separate color, because now I use that color, so let me use a red color. So this is our anterior border. So if you see the anterior border, I can say it is forming the posterior margin. You see this is the anterior margin, this is the superior margin, this is the inferior margin, this is forming the posterior margin. So anterior border forms posterior margin of obturator foramen. So that is your anterior border. Now the posterior border, if you look at it, posterior border, it is the continuation of the posterior border of the ilium. So in this picture, if you see, if you remember, I told you in the live class, this is the posterior border of your ilium, which is ending here. Now below this, whatever is starting, below this whatever we are starting, so this one is our posterior border of your, all this till it is meeting with the ramus. This orange line is our posterior border. So this is a posterior border. So I can say posterior border above. Here you can see posterior border above, it is continuous with the posterior border of the ilium, and if you come below it is it goes down. And I told you this is medial, inside is a medial, so it is continuous with the, so this portion is what we call ischial tuberosity. The entire thing, this all thing what we are seeing, this all portion. So you can say above this orange line, the red line, so you can see it is above, it is continuous with the posterior border of the ilium, and below it is continuous with the medial border of the ischium. So here we can say posterior border above, continuous with your posterior border of ilium, the red line, and below it is continuous with your medial border of ischial tuberosity, this portion, and this is this one. So this is your posterior border. Now lateral border, if you look at the lateral border, now lateral border is the one which is forming your lateral margin of ischial tuberosity. You can see that was a medial margin which is gone. Now I am putting this line. You see this line all the way. Now this border we can call this border. So I can say the lateral border is forming, it forms your lateral margin, forms the lateral margin of ischial tuberosity. Are you clear? So this is the lateral. So there are some more points are there. The posterior border, because posterior border I already told you about, is continuous with the your posterior border of the ilium. Below it is forming a medial border of your ischial tuberosity, and you can also see that if you come here, this entire thing is what we call as a, this portion, this notch, this is what we call as a greater sciatic notch. So this greater sciatic notch has got an upper margin which is red color, and then this part, blue part. So thereby we can also say the posterior border forms. You can say it forms lower part. It forms lower part of greater sciatic notch. And its upper part, and most of the 2/3 of the greater sciatic notch is formed by ilium. The lower 1/3 is formed by your ischium. In addition to this, if you can see, there is a spine is there here. So this is what we call ischial spine. The ischial spine also is formed by your posterior border. So you can see the entire ischial spine. So ischial spine, it is a projection which you are seeing below the greater sciatic notch. It is also the your continuation of your or beginning of your posterior border of your ischium. And below ischial spine, if you see, there is one more depression is there here. Can you see this depression? Now this depression is what we call lesser sciatic notch. So lesser sciatic notch is another depression which is formed below the ischial spine, which is again the continuation of your posterior border, and greater sciatic notch is a bigger depression above the ischial spine. So these are your two. So if you see, this is in the form of a letter 3. So you see here, this is in the form of a letter 3. So this one is your greater sciatic notch, and this one is your lesser sciatic notch, and this one is your ischial spine. So you can see from here, ischial spine onward, the entire thing is our posterior border. Okay. Okay, so I already told you about the lateral border. Lateral border forms your margin of the ischial tuberosity. Which margin? This one. That is your lateral margin of ischial tuberosity. So this finishes your borders of the body. Next we go to the surfaces. So again, let me bring the picture again. So we are doing now surfaces of body of ischium. See, again, go back to that slide. Here we are done with the ends, we are done with the border, where we mention about the anterior border, posterior border, which was very interesting, and lateral border. And now we are doing the surfaces. These are the surfaces. Again, you see surface of your body. So it has got 3 surfaces: femoral, dorsal and pelvic surface. So let us go to this. So there are 3 surfaces are there. There is a femoral surface. Femoral surface is also facing lateral, so it can also be called the lateral. And there is a dorsal surface. Dorsal means also posterior, it faces posterior surface. And there is a pelvic surface, it is forming the pelvic wall, so it is also can be called as a medial surface. So there are 3 surfaces are there. Let us identify the surfaces is in the body. So again, let us demarcate, or somewhere here I told you, yeah, this is a part where this is called the ramus. So ramus we have to always keep separate so we don't get confused. So everything, this all area, the blue colored area is our entire thing is our body. I told you the upper end, lower end borders are done in this. So now we are looking at the surfaces. Now what are the surfaces we have here? So femoral surface is also, so I already told you this is our anterior, this is posterior, so inside will be our medial, and this is where we are seeing the acetabulum, so this should be your lateral aspect. So this surface, so I can shade this, so it is the surface what we are seeing here. So this one between your anterior and the lateral border. See, this one I told you with the red margin I have drawn in the previous picture. So this was our anterior border, if you remember, and I have drawn this one as your lateral border. I don't know if you remember the previous picture, I have drawn these two. So between your anterior and the lateral border, so this was your anterior border, and this green one is the lateral border. So between the anterior and the lateral border, whatever the area you are seeing, this entire area, this entire part. Now this is what we can call this area as your femoral surface. Now why do you call this area as a femoral surface? Because you see this is the acetabulum into which the head of the femur will sit. So So once the head of the femur sit here, the shaft will be coming in contact with this part of the bone. That is why you can call this area as a femoral surface. So that's a femoral surface between the anterior and the lateral border. Now what is the dorsal surface? Now dorsal surface is the surface which is this area, which is, you can say, the entire part, leaving the acetabulum, because acetabulum has taken up the area of this portion. So you see above, the dorsal surface continues above with the your gluteal surface. So that is the gluteal surface of ilium above what we have, and inferiorly if you come down, that is your ischial tuberosity. So whatever the area which is there in between these two now, this entire part, including this groove also, this whole area is what we can call as your dorsal surface or posterior surface. So dorsal surface is continuous above with the gluteal surface of ilium, continuous below with the ischial tuberosity of the ischium, and the area in between. In front you got the posterior margin of your acetabulum, behind you got your ischial spine and lesser sciatic notch. So this entire area what we have between these four things is what you can call as a dorsal surface. Are we clear? So here you got the acetabulum, and here you got the posterior border, the ischial spine, greater and lesser sciatic notch. Superiorly you got the gluteal surface, inferiorly you got the ischial tuberosity. The red area is your dorsal surface. Now pelvic surface. Of course pelvic is a medial surface, so we can't see on this, so we have to go to the another picture on the medial side. So pelvic surface. So pelvic surface is where acetabulum is not seen. So this is our pelvic surface. Okay. So pelvic surface. So pelvic surface is also called medial surface. It is also forming the lateral forms. The surface forms lateral wall of true pelvis. A true pelvis, we know it is below the pelvic brim. So lateral. So this is our pelvic brim. This whole line is your pelvic brim. Below this it is. So that means this entire area what we are seeing here. So it is between. So it is a smooth area. So this entire part whatever we are seeing. So here if I have to demarcate, you just have to put the possibly this is our margin. So this is the ramus of our ischium. So we are not talking about it. And the entire part what we are seeing, this entire portion, which is shown blue in color, this is all is our body on the medial surface. So here you can see again, this will be our anterior border, this entire thing is our posterior border. Of course here we cannot see, or possibly here, this portion here will be here, possibly we can't make out here, maybe lateral border, but this is our, and this is our ischial tuberosity we are seeing. So this, now here we are seeing what we are noticing, here is our, this one is this smooth area whatever we are seeing, because somewhere here our ischial tuberosity is there. So this is ischial tuberosity is all on that side. So this entire portion what we are seeing is our smooth pelvic surface, and you can see it is forming here part of the lateral wall of the true pelvis. So this is about your three surfaces, right? So I hope these surfaces are clear. So that finishes our, you come here, that finishes your three surfaces also. Your femoral surface or lateral surface, dorsal surface or posterior surface, pelvic surface or your medial surface. So body is over. Now we have to go to the ramus now. So what exactly is the ramus of the ischium? Now ramus of ischium is, again I'll bring the picture. Okay, so this is the picture here. Ramus of ischium. Ramus word comes from the word rami, ramus, ventral rami, dorsal rami. Ramus means nothing but it simply means it is a process. You can call as a process or projection, or simply you can call even a branch. It is a branch which is coming from the body. So if you can call this entire, this area which I marked here, the entire portion you can call this, suppose you call this as your body. like your body per se, and this is one limb which is coming out of it. So this portion is the one which is actually coming out from your body. So this part, this projection is what we call as a ramus. From the body, a branch is coming out. You see, this is entirely is one piece. It's just a projection coming out. That's why it is called as a ramus. Ramus means a branch, a process, or a projection. So it is a projection from the body. That is why it is called as a ramus. Now you can see this ramus is actually uniting with here we have anteriorly the pink bone is your pubis. So this is also the ramus of the pubis, what we are seeing. But we'll be seeing in our next session that I will call this part. Just I need a little bit. This portion is what we call as a body of the pubis. Body of pubis. This is the superior ramus of pubis. This is the body of pubis, and this is your inferior ramus of pubis. So if you have noticed, pubis has got superior ramus because you see the pubis is like this. This is the body. It has got a upper projection and it has got a lower projection. So this is the body of the pubis. This is the superior ramus which is coming from up. This is the inferior ramus. Whereas in case of ischium, we don't have a superior ramus. So here you have. So thereby we can say the ramus of the ischium is meeting with the inferior ramus of the pubis. So this is what we form. So you can say it unites. The ramus of the ischium unites with inferior ramus of pubis, and with this combination now it is forming what we call as a, it has not joined, so it is called as a now conjoined ischio-pubic, because there are two are there, you can't use the word ramus, so plural is rami. So conjoined ischio-pubic rami. So conjoined ischio-pubic rami can be asked as a 5 marker or a 3 marker, even in the viva also. Conjoined ischio-pubic rami is a rami formed by the union of ramus of the ischium and the inferior ramus of the pubis. So now what we are doing now, instead of calling ramus, because I am now joined there, so we will be doing now what you call as a conjoint ischio-pubic rami. So this is an important question again after ischial tuberosity. This is the one which is quite important. So let us bring again the same figure here. So that's the figure here. Okay, this is posterior, this is anterior. Okay, now conjoined ischio-pubic rami, what are the features it has? Now this also has got, now there are borders are there and there are surfaces are there for this ramus. Now borders are again, there are borders are again two. There is the upper or superior border, there is a lower or inferior border, and the surfaces are also two. There is a outer surface or lateral surface, the inner surface or a medial surface. Let me show you this borders first. So if you look at this, so first let me demarcate the entire ramus. So somewhere here I am closing it, that was our body, and somewhere here I am closing this one. This is the body of pubis. You can say this is the body of pubis, and this one is our body of ischium. So both are body. In between them, this combination what you are seeing, this entire portion is your ramus. This is all is a ramus. This is conjoined ischio-pubic ramus. Conjoined ramus. Now in this you got the borders now, so I'll use a different color. So there is an upper border is there. So this one, what you see, this margin which I am drawing right now, so definitely this is what we call as a upper border, and this lower side you will be calling this portion as your lower border. So these are upper and lower border. So this is your upper border and this one is your lower border, right? So upper and lower borders are over. Now you have two surfaces are also there. So the surface which you are seeing now, this is what this acetabulum is there. So this one is we are facing on the lateral side. So this is the outer. So this is your outer surface. The entire surface is called as a outer or lateral surface. So if I take this another picture here and bring the other view, the medial view of the hip bone, then we will be able to see. So that's a medial view of hip bone, and here you see again, here also you can differentiate. So this one is your demarcation of both the bodies, and this is entirely the medial surface of the conjoined ischio-pubic rami. This one is your upper border, and this is your lower border, which I told you on the lateral surface. And this entire surface which you are seeing here, this is your inner surface. So you have seen the outer surface, inner surface, upper and lower border. So these are your borders and surfaces. Clear? So let me put down, because the surfaces are hidden there. It also has a surfaces, and the surfaces are, there is an outer surface or lateral surface, inner surface or medial surface. Now let us do the now again, if you see the inner surface, yes, inner surface, if you notice, so this is your upper border, lower border, this is our boundary. Now inner surface here, though it is not very clearly seen, but if you had a real specimen in your hand and if you rub your thumb on the inner surface, so inner surface is divided by two horizontal ridges. So there is one upper ridge is there like this, and there is one lower ridge is there like this. You cannot make out in the diagram because it is not shown. So there are two horizontal ridges are there, ridge. So these are your ridges. So which you can call as a upper ridge, this one, and this one will be your lower ridge. So now this two ridges are dividing the entire inner area into three. So you can call this as a upper area, middle area and lower area. So these are the three areas what we have, upper, middle and lower area. So this is, so all these three areas will give the muscle attachment. So this finishes your osteology part of it. Now we have to go to the attachment part of it, right? So let us talk about the attachment. I already spoke about the one attachment, that is ischial tuberosity. Another all attachments are pending. So let us do attachments and relations now. Now what we are looking now is the attachments and relations of ischium. If you have understood the first part, then only you can follow the second part. In case you have any still doubt, which is border, which is surface, I recommend to stop the class here and you rewind back, and one more time you go through what I have told, and then come back to this part, because if you have understood the first part, this part will be easy, because here I will be using the same terminology. I will be saying upper border, lower border, medial, lateral. So all those things you have to know. So thereby you have to keep it in mind. Okay. And since you are at home and if you are already having the bone set with you, then it is ideal that you take the bone set in your hand when you are going through this session. Okay, so let us see the attachment. First attachment is, I'll put down the picture. First one, we'll start from the back. Ischial spine. This itself can be a 3 marker. So ischial spine you already know. Ischial spine is the posterior border of your body of the ischium. It continues above with the lesser sciatic notch, and below it continues with the, it continues above with the greater sciatic notch, and below it continues with the lesser sciatic notch. So this is our ischial spine, which I am marking right now. Now this ischial spine gives attachment to a ligament. So first I told you where it is present, between what and what. So it gives attachment to ligament, and also it gives attachment to muscles, and it is also related to relation. So this is what is an important 3 marker to your nerve and the vessel. So one by one we'll see what is the attachment of your ligament, which ligament is attached to the your ischial spine. Ischial spine gives attachment to, name of the ligament, it starts from the sacrum. and it comes to the spine, so it is called sacrospinous ligament. I'll show you in the diagram also. Sacrospinous ligament attaches here, and it gives attachment to muscle now. So the muscle is again you got muscle on the upper part, so you can again divide this area into two. You can say like this, if I divide. So this is what we can call as a dorsal. So again muscle also I can say on the dorsal surface. Dorsal surface is this surface, or femoral surface, backside dorsal surface. Another one we can call this as a pelvic surface, which is on the inner side. So on the dorsal surface of your ischial spine and the pelvic surface of ischial spine. So what are the muscle on the dorsal surface? That means this is a dorsal surface what we are seeing. Here you got one muscle in the upper half. So in the upper part it is giving attachment to your muscle called superior gemellus. So here is a SG I am writing, that is superior gemellus. Lower part it gives attachment to another muscle called inferior gemellus. Some may call the gemellus also. Now the word gemellus word means actually twins, because both the muscles are together, so they are called as a twins. Gemellus or gemellus means twins. You even have the zodiac sign Gemini. Gemini, there if you see the symbol of Gemini, there you will see there are two characters are shown. So Gemini or gemellus. So we call there as a Gemini. So for that way you can call it a gemellus or gemellus. Anything is fine. So gemellus, superior gemellus, inferior gemellus are the two muscle, short tiny muscle, which are arising from the upper and the lower part of your dorsal surface of the spine. Now pelvic surface, if you see, so what was the ligament we have seen? The ligament was your sacrospinous ligament. And on the pelvic surface, which is on the inner side, so let me take a picture of that also. So if you go on the inner surface, this is your pelvic surface. If I overlap this figure on this, and then if I see, so this is our ischial spine, what you are seeing, yeah, this is ischial spine, and this one is our pelvic surface, right? This is a pelvic area. So here it gives attachment again to a muscle now. So this is a muscle which is from the ischium, it goes to the coccyx. This is a part of the levator ani. So here you have a muscle now. So this muscle is what we call on this side, you can call coccygeus. If you remember the other name of coccygeus is also called as a ischio-coccygeus muscle. So ischio-coccygeus muscle is it is a part of your levator ani, if you remember the muscle, right? So this is another muscle what we have here. So from the pelvic surface you get here, if you remember this part, fine, coccygeus part of levator ani. Now relation, so it is related to what? So it is related to nerve and vessel. I told you it is related to the vessel. So vessel is here, so that means on the dorsal side again. So again I'll go back to the picture, and on the dorsal side it is related to nerves and vessel. So this is again dorsal side, I put this back on it, and this is the dorsal side. So it is related to now nerve and vessel. So there is a nerve is there which is coming from the greater sciatic notch, lies on the ischial spine, dorsum of the ischial spine, and enter into the lesser sciatic notch. You may remember this, we are doing this. So these are your pin structure, what we call pin, P-I-N, P for pudendal nerve, I for internal pudendal vessels, and N for nerve to obturator internus. So there you can say there are three structures are there here. So only the vein is going back, the artery and the nerves are entering into the lesser sciatic notch, and via this it will enter where? Now there, via this way they are going with this, if they enter down here, so they are going into your ischiorectal fossa or ischioanal fossa, if you remember. So I said I will show you this. So let us see the picture. Okay, so here if you see this ligament, if you can make out in the diagram, this one again here, this is your ischial spine, and this ligament which is marked, you see this ligament here, it is going all the way to the sacrum, right? So this is the ligament here, you see this one. This triangular ligament is what we call as a sacro-spinous ligament. So here it is a posterior view, this one. Again anterior view, if you see, here you can see this triangular shaped ligament. This is your sacrospinous ligament. You can also see the muscles also, which I was mentioning. Let's see if we can see those muscles. So this is the one here. So here they are shown. So upper one is dorsum we are seeing. So this is your superior gemellus. Other one is your inferior gemellus. So now I will show you these three structure and the relation of ischial spine in this complete anatomy also. I hope everything is getting recorded. Yeah, it is getting recorded. Okay. It took quite a long time, possibly more than 12 hours to get the hang of this app. It is not user friendly, but it is useful for us to make things easy for us. So let us see. Okay, so this is a lower limb, and what I want to show you ligaments. Okay, so I can actually remove some of things which we don't need. Okay, so I can say multi-select and let us hide these things. We don't need this, so we'll hide all of this. Select the area. Okay, and here also you can hide these vertebrae. We don't need lumbar vertebra. I'll leave the sacrum in place. So I'll just make it big for you. Now hope you remember this is the right side now what we are seeing, and I hope this is, you see, this is the front view what we are seeing, this is the side view, and this is the posterior view. The only problem with this app is just writing becomes more difficult here. So but anyways, I'll try my best to make it. So this is what is the anatomical position, little lower down here. Okay, so this is how it lies in the body. Okay, now I said I want to show you the spine now. So ischial spine, and we need to see the first is the ligament. So I'll use the pen tool and I'll write here this corner so that it won't come on our way. So what ligament we are seeing to the spine, this is to the ischial spine. So ischial spine, the ligament is sacro-tuberous ligament. I already showed you, and we are seeing the muscle also. So muscle on the, that is your on dorsal side, your superior gemellus and your inferior gemellus. You'll be seeing on the inner side the muscle is your levator ani, part of levator ani. It is your coccygeus part. And we also want to see the relations of your pin structure, pin, pudendal nerve, internal pudendal vessel. These are the structure which we can see on this. So let us see now. So first we'll sacrospinous, the ligament. on the right side. Yes, this is so many. Okay. Okay, now look at this at the back. I'll take the figure a little up. Now you can see. Now again I'll use the pen, and this one is your spine, and this is your sacrum, and what we have here is your sacrospinous ligament, right? So that's your ligament what we have. Okay, so this is the ligament part is done. So see, this is something, pen part is something which is very tricky with them. Anyways, I can get rid of all the pen mark. Okay. Okay, now next is we got the, now next what we need is the muscle now. So what muscle we need is superior gemellus. So let us, I'll write down all the, so that we can see already. Superior gemellus. Superior gemellus we need on the right side, and we also need inferior gemellus. This also we need on the right side, and on the inner surface we need a coccygeus muscle on the right side. Coccygeus muscle, right. Okay, and after this we'll see the nerves and all. Okay, now first see on this side, where is the other muscle? This is only superior gemellus, inferior has not come. Inferior now you can see both the muscle. Can you make out the muscle? So this upper one, when I am clicking on it, you see on the top it is written, and on the left side it is written superior gemellus right. When I am clicking, this is inferior gemellus left. So these are the two muscles which are coming from the upper and the lower margin of it. And if you go and see the inner aspect, now you see there is another muscle. Now this muscle, if you see, this is your coccygeus muscle. It is nothing but your ischio-coccygeus. It starts from the ischium and goes all the way to the coccyx and some part of the sacrum also. This is the muscle which we see on inside. This is beautiful. I think I'll not forget this where they are. Okay, here, but this muscle you are seeing, these are like lying as it is. So if I put the femur back there, so if you want me to put the femur back, now you see, now that's the attachment. So we will be seeing that the attachment of your superior inferior gemellus somewhere into the medial surface of your greater trochanter. Anyways, that is not our concern right now. We'll see that later, but right now, so we are done with the muscle. Now what I need is the relations now. So I even have the relations of the nerve now. Let us look at the nerves. So what nerve we have here? Pudendal nerve. So pudendal nerve. So where is our pudendal nerve? Right here. We got pudendal nerve 1, and next along with pudendal nerve we have internal pudendal vessel. Internal pudendal. Both one by one I have to take. First internal pudendal vein is there, then internal pudendal pudendal spelling P-U pudend P-U-D-E-N pudendal N-D, no, pudendal. Okay, so this is, yeah, I got the artery also, vein also. Now I need one more nerve, that is nerve to obturator internus. Nerve to obturator. Nerve to obturator internus, that also I need on the right side because I am seeing the right everything. Okay, now with this Now we have these structures also in place. Now if you see here, so you see all these are on the dorsal side. So these are all on the dorsal side. Now let me see one by one. Now first if I select this, this is a nerve, yellow one. You see the name appeared on both the side, on the top and on the left side. It is nerve to obturator internus. So obturator internus is definitely inside. So right now we don't have a muscle, but the nerve is definitely related to our ischial spine. And next to it you also see there is a red color, sorry. So next to this you also see there is a red color artery. This is your internal pudendal artery, and next to blue one is your internal pudendal vein, and this one is your, sorry, this is your pudendal nerve. So these are the structure what we have. Basically if you see, as per this particular atlas, it is only saying that the nerve is the one which is related to the dorsum, whereas your artery, that is your internal pudendal vessel, and pudendal nerve, they are not related. They are actually lying on the sacrospinous ligament. So that also is fine, but so thereby the only thing which is non-debatable is only your nerve to obturator internus is lying here. The other two structures are more medial. So if you see the relations here, they are, if you see the relations here, if I put down the pen, look at the relations. This is medial to lateral. If you see, you got PIN. So pudendal nerve is the medial most, which is here. Then your vessels are your intermediate, and this is your lateral. See, this is what is the relationship what we have here. Okay, so this is your relations of your ischial spine, right? So this is, now we go to the lesser sciatic notch now. So I'll go back to this. So here we are, so we are done. So what we are doing, what are we, okay, so we are done with the ischial spine. The first part we are done. Now we go to the second part of the attachment. The second part of the attachment and relation what we have here is, number 2 is your lesser sciatic notch. And lesser sciatic notch, again get the picture, and I can use this picture only, which I have taken from the app. Here you can see this is for here the color maybe I can use. This was your ischial spine, right? And this is your greater sciatic notch. So thereby this small area below is your lesser sciatic notch. So we are looking at the lesser sciatic notch. Now lesser sciatic notch, it has a groove. There is a notch is there, that means there is a groove is there, so gap is there. So what passes through this gap? So through the gap is your tendon of your obturator internus. And we have already seen here your gemini already, gemini are also there here only. You got your inferior superior gemini, we have already seen that part of it. So you see superior gemellus was superior margin, inferior is here. So thereby we have seen the gemellus. So there is, this is your superior gemellus which was above, and inferior gemellus is actually even to the part 2, even to this also, that is your inferior gemellus. So we can say in the groove you have the tendon of obturator. It is not taking origin, but the tendon of obturator internus is passing through this lesser sciatic notch. Other than that, you have superior gemmelli and inferior gemmelli muscles are there. So let us see now these things also in our app again. So already we have a picture here in place. So what I have to add here, I can I leave it now as it is. So I'll add one more muscle to this, and that muscle what we need is your obturator internus, right? Yeah. So this one, you see now what we have done. If you see this from the picture here like this, so this is the right side, that's obturator foramen, and here you see obturator foramen is filled with that muscle, oval shaped muscle. And if you see from the back now, okay, so we don't need the vessel, so I think I can hide the vessels now. Sorry, Okay, this is the muscle. Now you see, now this I have isolated. Now see the muscle. This is right now, this is, you can see below the spine. I can't write anything in this mode, so you have to understand that below the ischial spine, that groove what you are seeing is the lesser sciatic notch. Through that the tendon is passing. So where it is going is right now not our concern, but the tendon passes through the lesser sciatic notch. This is one part of it. And other thing is, this is here superior gemellus. So if we isolate and see this, now you can see superior gemellus is also coming from your ischial spine, or a little closer to, you can see this is the upper margin of your lesser sciatic notch also you can call. So that is the reason it is explained in both the cases. Yeah, now we go to the next muscle, and next is the inferior gemellus. So you see inferior gemellus, again it is neither looks like in this diagram, it neither looks like it is from the ischial spine nor from the notch, but we have to, as per the explanation textbook, it is from the lower margin of ischial spine and the ischial and your lesser sciatic notch. So that is your inferior gemellus. So there is some discrepancies there between the textbook description and this app, but anyways, this is doing a fairly good job for us. So you see all the three muscles, if you see from top to bottom, superior gemellus, this one, then the tendon of obturator internus, this one, then the inferior gemellus. All these three together, they all have a common insertion. So if I put the bone there here, you see now, they all are going to the common, you can see here, they all are going to the medial surface of your greater trochanter of femur. So these three muscles together is what we call as, all the three, these are called as a your tricipital tendon, because the three are there, so they are called tricipital tendon. So that itself is again a 5-marker question. We'll be seeing that later. These are all the structure and recover of gluteus maximus. So this is your three muscle, the muscles are there. So this finishes our lesser sciatic notch also. So if you want, let us go to now this thing. Okay, so this is where we are now. We are done with this part of it. Now next part is we are doing under the attachment and relation. Now let us look at the surfaces now. So if you remember, there are three surfaces we mentioned. So I'll bring our picture again back. So more and more you see, better you remember. And I'm intentionally being very slow here so that you follow it nicely, because if you don't understand the osteology well, you will not understand the rest of the lower limb at all. So there are three surfaces are there. If you remember, the surfaces are lateral surface, also called femoral surface, and there is a posterior also called dorsal surface, and the medial surface is called pelvic surface, right? So first we will see, in this we can see two surfaces. So femoral surface, so it is between your, this is your anterior border here what we have, and this is your lateral border. So in between this, whatever the surface is there, here I am writing the name, this we call as a femoral surface, right? Because it is facing the femur here, femur medial surface will be facing here. Now this femoral surface is giving attachment to, what are the attachment to femoral surface? You have obturator externus. So this obturator externus, if I just rub this, and so obturator externus is taking origin here. It is along the obturator margin, that means very close. So this is what I am drawing. So this one is our muscle, I can say. This muscle is our obturator externus. It is from the lateral side. Fossa is here. So obturator externus is a muscle. Then you have second muscle is your quadratus femoris. So I told you obturator externus is here along obturator foramen margin. So along the obturator foramen margin or anterior margin of your ischium, that is our obturator. So this one will be behind this. So here behind we have one more border. You know this border. What is this border we call? This is our lateral border of ischial tuberosity. So along this border, little in front of it, you have another muscle now. So this is another muscle what we have, and this muscle is our quadratus. It is quadrangular in shape, and it is going and attaching to the femur. That is why it is called quadratus femoris. So this is, you can say this is along the lateral border. Lateral border, yeah. So we will see these two muscle on the femoral surface, and again we'll come back now. So let us go to the app again. So yeah, so now what muscle we need, I'll just type the muscle obturator. Sorry, obturator was already there. Obturator externus, and remember I need the right side because I'm doing right. Okay, and another muscle I need is the quadratus femoris on the right. So these are the two muscle I need. Okay, now you see here what I have got. First is your obturator externus. So you see here, this is identify your, I'll use a pen here. Yeah, see, this is the surface we are talking. Yeah, this is the entire surface is a femoral surface. Since it is facing the femur, you see here it is facing the femur, that is why you call the surface as a femoral surface. Now this side you see, you got the muscle here. Now this muscle is taking origin entirely from the obturator foramen, but we are only concerned with this part. This muscle is taking origin like this from the all throughout the margin like this. So our concern is only this part of it. So we can say from the posterior margin of your obturator foramen, our muscle is taking origin. So this muscle is our concern right now. So this is the muscle what we have, and you see here if I am turning it now. So let us do one thing. I separate this muscle, so we will have only this muscle. Now this muscle is beautiful. Now you can see the muscle now very well, you can understand. Now this is where I will see here, this gap what you see, that is what I was telling from the anterior margin of or anterior border of your ischium or the posterior margin of obturator foramen. That is where it is taking origin, and you see the muscle goes all the way behind. You can see it is going behind and it is inserting again to the greater trochanter. So where we will see that later. Right now it is not our concern. So obturator externus is fine. Okay, now next muscle is our quadratus femoris. Now this also we have already selected here. You see this is again, if I go in the lower, you see here, yeah, that's a muscle. If I select this, you see it is quadrangular in shape. Upper border, lower border, medial margin, lateral margin. So it is quadrangular in shape. That is why it is called quadratus femoris. Now we'll isolate this muscle to see. Now you see this muscle again, you can see here it is taking origin. Can you make out here? So this area which is behind here, from the area here I can't put any pen or anything, but if you want, what I can also do here, a little extra step, but now I can put a marking on this. See, I have figured out so many shortcuts here. Now this is the area where this part was our obturator externus we told, and you see from the behind, little behind in the same surface, femoral surface, you have this muscle, and this muscle is what we call now quadratus femoris, right? So this is what we have seen now. So thereby, yeah, this is clear. Okay, so going back, and we have now two muscles are there, quadratus femoris and obturator externus. So we are done with the femoral now. So yeah, okay, so we are done with the femoral surface. Now let us go to the dorsal surface. Now what is dorsal surface? Is doing dorsal surface, I told you it is dorsal surface is this area, this entire between your posterior margin and the acetabulum, and here below you got the ischial tuberosity, and above this is a gluteal. So that area whatever is there in between this, so this area, if I mark the arrow, this is the area which is our dorsal surface. So from this dorsal surface what comes out? So here again we can say there is a two areas I can divide this into. There is a groove is there. So right now you see I am writing the word groove. So this is a groove, like something like a tunnel which is extending between the ischial tuberosity and here anteriorly you got your acetabular margin. So this is a groove. So in the lower part you got a groove, and in the upper part the rest of the area. So this entire part I can call, this is convex. If you have a bone in the hand, you will be able to see this entire area is your convex. So I am dividing now the surface into the convex part, which is the upper part. So upper convex part, which is shaded now, and the lower is the groove is there. So these are the two parts of your dorsal surface. So what happens in the upper convex part? So as such, you see there are no muscles here in this. There are no muscles which are taking origin or insertion, but in the upper convex part. So I'll just clean this part a little bit because it became a little dirty. So again, so here let me draw this. This is a groove what we are seeing. So this is the groove. In the lower part you got the groove, and in the upper part, this entire area what we have, this entire portion. So this is what we call as a convex part. So now I am saying in the upper convex part. So what is related? So in the upper convex part, again as I told you, there are no muscles coming there. It is only the relations in the upper part. So what are the relations you have here? So you got a, again the relations are, there is a muscle you have in this area. So what muscle is there? Your piriformis. So piriformis is actually passing from here. So you towards the insertion towards the femur. So it is actually related here. So piriformis muscle is one, and then other are your nerves. There are two nerves are there. One is your thickest nerve of the body called sciatic nerve. You will follow when I show you in the app. And there is another nerve called as a nerve to quadratus femoris. If I put these three things, that is muscle called a piriformis and a nerve. So you see from the greater sciatic notch, the nerve will come out like this. That the big nerve which is coming down, that is here, will be related like this. So that is your sciatic nerve. And from here only again you will be having one more nerve which will be coming, and that is your nerve to quadratus femoris, because you remember the quadratus femoris is lying here. Our quadratus femoris muscle is here. So the nerve has to come down to supply. So that is why the nerve that is also there. Piriformis is also coming from this area like a comb. So anyways, in the app you will understand this better. Now these are the relations in the upper convex part. What about the relations in the groove? So why do we have a groove? So from the groove, what passes, that means the inner side of the obturator foramen, you have the obturator internus. If you remember, obturator foramen inner margin gave obturator internus. From the lesser sciatic notch the tendon came, and the tendon of the obturator internus actually passed through this groove in order to go and insert to the femur. So thereby what passes through the groove? Your tendon of obturator internus. So we will see this groove and the upper convex area in the app. Okay, so now what do we need now here? Okay, first I will show you the already which is there in the groove. So let us select and isolate. Now you see here, this is our obturator. This is our obturator. Yeah. See, okay. See your obturator internus passing through your below the lesser sciatic your ischial spine and passing through the lesser sciatic notch, and then it is actually passing through this groove. I don't know if you can make out the groove. So what I'll do is I'll take a screenshot here so that I can draw it. Okay, so now this is the groove I was talking. If you can remember here, this is the acetabular margin which is in the front, and here is the ischial tuberosity at the back. So this is the groove. So you can see this is the tendon. This is the tendon of obturator internus which is passing through this, right? So this is the one structure. So now we have to also know what are the areas which are passing through this part. So that means here this we told, right? Here this is the area we also mentioned that it is related to your piriformis, related but not attachment. Okay, piriformis, then sciatic nerve, and your nerve to quadratus femoris. Let us go back to the app again. Okay, so now what I need here is a sciatic nerve. So let us bring the sciatic nerve to quadratus femoris. Sciatic nerve, right side, I got it, and we need nerve to quadratus femoris, right? Yes. And I also need a piriformis, piriformis. piriformis. Again, right piriformis. Okay, so we have all the structure one by one. So if you see in this picture, I'll just mark it. So this is our piriformis, and this one is a sciatic nerve, and this one more nerve, what you're seeing, that is, you see, going, this is our quadratus femoris. So this nerve should be nerve to quadratus femoris, right? So again I'll clear this, and now you see, look at the piriformis. Now see the piriformis taking origin from your sacrum, from your upper margin of your greater sciatic notch, and you see here coming all the way, passing down, and this is the area. See here, when I show you inferiorly, you see the muscle is not taking any attachment to that area. It is just related. It is just like passing. Yeah, so that's a beauty. And this is your muscle. Now next is we need the sciatic nerve. Now let us look at the sciatic nerve also. If you see sciatic nerve, now of course sciatic nerve is coming from its origin from the sacral plexus, passing through the greater sciatic notch, lying over the lesser sciatic, lying over the ischial spine. Then you see again it is related. Again you see when I do this, you can see the gap. That is why we say it is related to this area, right? Okay. Next is here another nerve, that is nerve to quadratus femoris. Now this is beautiful. You see very cute nerve here. Sorry, isolate. Now you see here the nerve is very cute, coming from the lumbar plexus here. The root value also it is shown. So here possibly it looks like here L4, L5 and S1, and nerve is again passing, coming on from the greater sciatic notch. Now you see again lying in this area and going to the area where it should supply your quadratus femoris. It also looks like supplies the capsule of the hip joint posteriorly. Again you see it is not, it is just related in this area. Yeah, so you got two nerves and one muscle which is related to the convex part, whereas to the groove we have seen it is related to the tendon of obturator internus. So that finishes your dorsal surface. Now there is only one surface now here, and the dorsal surface, the lower part, yes, which I have already done. So again I will take this eraser and rub this part of it. I have already done this part here, remember? So dorsal surface, this lower portion I have already done. We have divided this into upper, lower, vertical and all. And so why I am doing this, the dorsal surface, if you see continue now, you can say dorsal surface continue down as your ischial tuberosity. So either I call as I am doing ischial tuberosity, or I can say I am doing the lower part of the dorsal surface. They both are one and the same. And here what we have is, so let us put down the ischial tuberosity beautifully like this. So this one I call as a superior, this is inferior. I will call this as a medial and lateral. So this will be your superior and lateral, so this should be your superior lateral area above. This one is your, sorry, this is your inferomedial. This area is your inferomedial, and this one should be your medial part, and this is your lateral part. So we are doing the ischial tuberosity attachment again. I'll show you in the picture app, there you will understand better. Please know the names again. Superolateral, you have one muscle, that is semimembranosus. It is half is membranous and half is muscular. That is why it is called semimembranosus. Whereas here you got two muscles. So what are the muscles you got here? You got your semitendinosus and your what is the name of the other muscle? Long head of biceps femoris. You can see the time right now, it is 12:38. My neck is paining also. I took the whole day to actually get used to the app. I have this madness. Until I don't understand anything, I cannot take it. So now I got the hang of the app, so I think possibly now a recording of the classes will happen fast. Yesterday and today, the entire day went in understanding the app only. Okay, and the medial part here we said it is a subcutaneous and it is related to the bursa, and whereas the lateral part it is related to your adductor magnus. So this part you already know, so let us see this in our app now. Okay, so app, now let us add our muscle. So what we need the muscle now, we need our semimembranosus, yeah, and then I also need another muscle now. What is that muscle? I need semitendinosus, yeah. I also need a muscle, long head of biceps femoris, right. 3 muscles, and one more I need, that is your adductor magnus, and I need right one. Yeah, I think I got all. It became quite crowded now. Don't worry, isolate feature is there. With that we'll be able to figure out, so nothing to worry. Okay, so what we need now, muscle. Now look at this part first. See how crowded it is now. Get the idea. See, it's the area where we actually set the ischial tuberosity. Can you make out the ischial tuberosity? One side, on the left side it is. You are not covered. I can use a pen. You can see this is the area we are talking about. This is the part on this side. Here it is uncovered, here it is covered, and there are muscles are there. So let us see the muscle one by one. So first is here, you see downward membranosus and tendinosus. If you see this muscle, you please notice here, forming the boundary of your popliteal fossa. If you notice, this one is like more like a tendon. You see, this is more like a membrane, flattened, and the superficial is more like a tendon. So this is your semimembranosus and this is your semitendinosus. So with that, if I go up now, I'll be able to trace this. You can see here membranosus. This is the so this one is your semimembranosus. See the name you got. No, this is tendinosus. Here down it is tendon, correct. So deeper one, this one is your flattened one, is a membranosus. So first let us see here semimembranosus. We'll isolate this, and now you see this in our picture. Now I enlarge this. Now see the ischial tuberosity, and I told semimembranosus means kite, it should fly. So it is from the lateral part. You see the medial area is empty, it is from the lateral part. You can see. So this is your inferomedial part, and this area you see it is your superolateral part. So from the superolateral part you have semimembranosus coming out, right? From the medial part you should have 2 muscle now. One will be your semitendinosus, similar muscle, but down it will be ending as a more tendon. Other one will be your long head of biceps femoris. So let us see this. Okay, so now let us say this is our semitendinosus. Now you see this one. It is lying coming on both sides. I can show, I'll try to see both the picture if I can bring together, or I'll bring all the together once we see this individually. Again it is on more on the medial side, going down there. Yeah. Now let us bring our other muscle, and we need this muscle, the bulky one. This is your long head of biceps. I can see the long head. Why it is cut there? Because the lower down, the short head will join together, so both will form a single head. Bicep femoris, you can see this is also almost from the same. all these three, if I put together, I'll try now to bring all the muscle multi-selection, these two, and which is the other one here, this third one. All these three, if I do isolate, yeah, you can see here how they are. So you can see all three of them. This is your innermost, is this one is your membranosus. So this is the right side, so this should be, yeah, all three. Got it? So these are your three muscles which are coming from there, and I'll little explode this. You see, this is how the attachment. Then you know, if you see, keep like this, it doesn't look, but when we explode this, then you see. Now this one is your long head is here. This one is your semimembranosus, semitendinosus. See the tendon, long tendon, and this one is here long head. Fine. Okay, so this is about your those. Now one more muscle is left here, and that is our adductor. One more muscle we have here is see this big muscle what we are seeing, this muscle. This is your adductor magnus muscle. So adductor magnus, sorry, I have to isolate this. Now you see this muscle from the back again. Adductor magnus. Now here you can notice adductor magnus is arising from the lowermost here. It is in the lower part, and you see this is an area. Again, I can take a photo. So where is insertion is in the femur, that is not our concern, but this one I can take a photo. Sorry. Now you see here, this part is empty. So this is subcutaneous, on which bursa will be there. This is from the lateral part. So here you can see this is dividing into, this is how the division was there. So here you got your semitendinosus and your biceps femoris long head, and here was your semimembranosus, and down you, this is the muscle is your adductor magnus, and that is subcutaneous area where we'll have a bursa, Weaver's bursa, I told you. So this is about your ischial tuberosity. So let us go back to the lecture. So this is our ischial tuberosity. So we have done ischial spine, lesser sciatic notch, and now we are doing the surfaces. There in the surfaces we have done femoral surface, where we have seen these two muscles. Then we have done dorsal surface, where we have seen the upper convex part related to the muscle and nerve, and lower groove part related to the tendon. And here only the lower continuation we have seen our ischial tuberosity with the muscle and the bursa. Now the last surface is your pelvic surface. So what is the pelvic surface is related to? Pelvic surface is very simple. There's nothing much. So pelvic surface. So for that I have to take another figure. So let me take another picture, or I can go to the next image, next page also, because it became already crowded. So yeah. So this is our next image we have. There's a pelvic surface here. So now this is the pelvic surface, if you can remember, the entire area whatever we are seeing. So this entire portion will give rise, and this is upper 2/3. So almost you can see almost this area except this portion, except this part of it, the entire area, that means this area whichever I am feeding right now. You remember like a deepam I told you in my last class, where that jot of the deepam, that is the fire of deepam, it comes like this. This is entirely the muscle. It is going here also. Right now this is not our concern, but I am saying that shaded area. So this is except this area. So this portion is not giving origin. So this part is giving origin to your obturator internus muscle. This we call as a ischial origin of obturator internus. this area which is left out, if you remember, it is actually a lower 1/3 part. So it is forming a lateral wall of, someone might have guessed, where ischio-anal fossa. Remember the lateral wall of ischio-anal fossa? Like this, you remember? Here we said the upper part, this is covered with your obturator internus, and lower part we say this is ischial tuberosity, right? So this is, you see, ischial tuberosity, this surface, medial surface. So this is that area right now. So you can see, we will even say that what is the extent of your what do you call your ischio-anal or pudendal canal. Pudendal canal extend from this lesser sciatic notch all the way. You see here, this is where it is. And how when we do the perineal approach, we feel for the spine and then we give the anesthesia, remember? Okay, so that is the part of it. So here you have only two things. Obturator internus is the muscle. The lower part is related to your ischio-anal fossa. That I did not show you, so I'll just show you this muscle in the app, and then we are done with this surface also. So muscle, I think, is already there. So just will select our muscle. Yeah, that is externus. Our internus is inside. Yeah, that is our internus. So isolate this. Now you see. Now you know this muscle, beautiful muscle, fan shaped muscle. So I'll just take it this, and then I'll take a figure. Now you see here. Now this is the part origin which I was mentioning. This entire, this is the origin. This entire part, this, you see this area which I left out here, and this is the part which is actually related to your ischio-anal fossa, your lateral wall in the lower part. The rest is your obturator internus. See, obturator internus takes origin, this is what we call, this portion is your ilial origin, and this one is your pubis origin, we will be seeing in pubis, and this origin is we call as a conjoined ischio-pubic rami origin, and this origin is what is your origin from the ischium. So thereby you see it's taking origin from all the three hip bone, ilium, pubis, ischium, and conjoined ischio-pubic rami, and forms a small tendon. This tendon just passes beneath the ischial spine through the lesser sciatic notch, through the dorsal surface, growing through the groove, and it is going to the medial surface of your greater trochanter and inserting. Yeah, so this is your attachment. Only one muscle is there related to your pelvic surface. So that finishes your pelvic surface. So pelvic surface, one muscle, and related to your, forming a boundary for your ischio-anal fossa. Now the last part is your conjoint ischio-pubic rami. Here we will see the attachment. If you remember, we have already said that it has got borders. It is simple part, it is not difficult. Borders are there, and I even told you it has got surfaces. So borders, I told you, there is a upper border and there is a lower border, and surfaces are outer and inner. So let me bring a picture here. It is just that some of you may remember and some of you may not remember what I am saying. So again and again, if I do it multiple times, you guys will remember better. So you see, this is your so I'll draw it here again. So this is the limit, and this is always give me a feeling of that eraser. During my time, that pen eraser used to be there. One is like we call eraser for your, this used to be called as a pen eraser, and this used to be called pencil eraser, dual eraser. Nowadays it is not available. Maybe you can ask your parents and all, they may have this, or you might have seen also double colored. Anyway, so that's just a nostalgia feeling. So you don't have to write anything of this sort in your exam. Just every time I see this, I remember that. Okay, so this is a conjoined ischio-pubic rami. So this one is your upper border, this is the lower border. Now what are these things which are attached? So to the upper border, what is attached? It is the lower margin of your obturator membrane. So obturator membrane is attached to this, to the upper. So you see the entire area is covered by your obturator membrane. So we say the obturator membrane lower margin is attached here to the upper border of your conjoined ischio-pubic rami. Whereas what is attached to your lower border. So here you have the attachment of two things. One is your fasciolata. What is fasciolata? It is your deep fascia of thigh. So deep fascia of thigh, it is like a stocking. So you are wearing it, it comes all the way up and it should attach where? So posteriorly I told you it is attaching to the entire length of iliac crest. So anteriorly it will, where it will attach? Anteriorly it will attach to your inguinal ligament. So somewhere it has got medial attachment is there, and then posterior attachment is there. So that medial will be to the pubis and the posterior is to this guy, that is to the lower border of your conjoined ischio-pubic rami. So apart from this, it is also giving attachment. It is also giving attachment to what happened. So it is also giving attachment to the collis fascia. Remember collis fascia of perineum? It is also called as a membranous layer of superficial fascia. You might have forgotten everything. Superficial fascia. So I may not be able to show you collis fascia because the app is not went to that detail. Fascial lata I can show you, and obturator membrane I can show you in the app. So let us see the app now. So we're seeing now we need the obturator membrane. So obturator membrane, obturator membrane. Yeah, I got obturator membrane. Then what we need? Fascia lata. Fascia lata, connective tissue, not the most. Fascia lata, right. Okay. That's beautiful. There is a deep. Okay. This entire transparent membrane is your fascia lata. Okay. Backside it is deficient because there you have the buttocks are there. That's the lower margin. Okay. So what I have to show you first is the obturator membrane. So obturator membrane is present. First we can see this because I have to hide this, then only I can see. This is your, let us isolate this. Now that's your fascia lata. Now here I have to show you this attachment. Here this is the attachment we are concerned with to the lower border, remember? So now you can see. So this is the lower border of conjoined ischio-pubic rami, and this is the attachment of the fascia lata. So you can see the fascia lata is attached here. The same way on this side also you will have the attachment of your perineal membrane or collis fascia, collis fascia, which is not there in this app. So I tried searching, it is not there, so will not waste time, but it will be present something like this. So next is I can hide this so that we can go back and let us hide this. Okay, now I need the membrane. So you see here there is a membrane is there. I select this and isolate. Now you see that's a membrane. You see this side, outside you have the muscle obturator externus, inside you have a muscle obturator internus. So in between them you got the membrane. This is what we call. Now you can see here. So if I take a picture, and so that I can take a, can scribble on this. So this is your upper border we have to. So upper border, whether outside or inside, on both sides this upper border of your ischio-pubic rami. It is giving attachment to your obturator, lower margin of your obturator membrane. This is the lower margin, right? Okay, so this is about your upper and lower border of your conjoined ischio-pubic rami. And we also know that there are surfaces are there. Surface is the last part, and with that we are done with the ischium. So surfaces of conjoined ischio-pubic rami. So here also you have an outer surface and an inner surface. Outer surface I will bring the picture again. Obturator foramen means that is outer surface. So this is outer surface, but this is upper margin, lower margin. This entirely is the outer surface. Now this outer surface give attachment to, let me write down here, couple of muscle from from above downward. So from above downward, if you go, the muscles are your obturator externus, then you got adductor brevis, and there is a acute muscle called gracilis, and finally there is a muscle called adductor magnus. Now out of these muscles, if you see adductor brevis and gracilis, only a part of it will come to your conjoined ischio-pubic rami outer surface. So chiefly, that means the majority of this muscle, chiefly they arise from your pubic inferior ramus. So this muscle we will see again there also. Similarly, adductor ramus is chiefly arising from your ischial ramus. That means 2/3 of the muscle is present on the ischial ramus, only 1/3 is present in the conjoined pubic rami. Similarly, the other two are there. So your exclusive main muscle. So if I draw it here, your obturator externus should be something like this. This is your obturator externus. Obturator externus will be throughout like this. So here we are saying that this part of the externus is present here. Then you have this muscle, so adductor brevis I told you. So the brevis will be, majority of it will be here on your ischial, what you call pubic rami. Then gracilis also majority will be on this side only, 2/3. And adductor magnus, majority, you see adductor magnus we said here is arising from the ischial tuberosity. So it is only a part will be coming. So these are the muscles what we have. So this is your obturator externus, this is your adductor brevis, this is your gracilis, this is your adductor magnus. So let us see these things in our app. So obturator, I think adductor brevis and gracilis I have to add, the other muscles are there. So adductor brevis, adductor brevis, right, and I need to add gracilis muscle, right. Other muscles are there. Okay, first we will see here the known muscle which we know, obturator externus. This is the one. Isolate. Now you see, if you see this one, this is the outer margin, and we are seeing it is definitely taking origin from the uppermost area of the conjoined ischio-pubic rami, right? Okay, next muscle, if we go, I said the remaining muscles are either belong to your pubic rami or the ischial rami. So this muscle is your adductor brevis. When you isolate, you will realize, see, the most of the muscle actually is arising, you see. So very little bit muscle is arising from your, see, that is why we say here in this app it is showing the muscle is entirely arising from the pubis and not at all from the conjoint, but the text says it is partly few fibers, 1/3 fiber come from there also. So this is your adductor brevis. Then this muscle, the long, slender, tiny, long muscle, see here, this long, slender, tiny muscle. And this muscle, if you isolate, now you see, this also some fiber, very few fibers may go. As per the app, it is again nothing is arising from the conjoint ramus, but as per the text it arises. So this is another one, and we have one more muscle, that is your magnus. So magnus also, you notice here also, if you see here, now if you notice, then you will get the idea. You see here, now this kind of orientation we can't get even in any. So this app is good this way. You see this in between. So that is, see, most of it you see here. If I take the picture like this, then maybe I can tell you something which I want. Now you see, this part is using, this is from your ischial tuberosity, which we have seen, and this portion is, you see, from the ramus of ischium. So that is your adductor magnus. Yeah, right. So this is about here all the muscles which we see from above downward on the outer surface. So now let us see the last part, and that is your inner surface. So inner surface, I can take inner surface is, if you remember, I told the inner surface again divided by two transverse ridges into three areas. And what happened? It is not loading the image. Okay. Inner surface. Okay, so this is your inner surface, and I mentioned you here, this is here it is divided by two ridges, an upper transverse ridge and lower transverse ridge into three areas, remember? So this is your upper area. So in the upper area you have the origin of obturator internus. That is very clearly, it is a common sense, because the entire margin will give internus. Then in the middle part is quite crowded. Here you have deep transverse perineal muscle. You remember the muscle from the deep perineal pouch? Yes, deep transverse perineal muscle. Along with this, it is also related to, here it is related to your dorsal. This is the content of this dorsal nerve of penis and clitoris. This is the only muscle is attached there, but the nerves are passing through it. And you also have your internal pudendal vessel which are passing through this. I don't know if you can remember the entire story of these when I told that they will pass from the back, they will go into this, and then they will enter into the front. Okay. Now the lower part, here you got your penis, male, clitoris in female, plus there is a muscle which you know, you have read in the superficial perineal pouch. These are all superficial perineal. So that means this is this area beneath that is all the superficial perineal pouch, ischio-pubic, and your superficial transverse perineal muscle. So if you see, if I use a different color here, possibly this color. So this area, this is the area where your deep perineal pouch is coming. The bony relation, we say the conjoined ischio-pubic rami. Remember the laterally here. See, this is how we were doing that time. I don't know if you remember this. And here, this is the perineal membrane. So this is what we are calling this one as a lateral margin by conjoined ischio-pubic rami. So here these are the areas where we are. So we are saying the deeper aspect, you got deep perineal pouch, inner aspect, and superficial perineal pouch down. So the same thing here you are saying, that is superficial perineal pouch. Now both the pouches, you remember, are separated by a perineal membrane. So perineal membrane should be attached to this line. So the line, the lower ridge which is separating, you see now I'm putting a wavy line. That wavy line is your perineal membrane. So perineal membrane is attached to the lower ridge. So this is beauty. I like this part very much. So inner surface is obturator internus, deep transverse perineal muscle with the dorsal nerve of penis, clitoris, internal pudendal nerve and vessel, and your crus penis, ischio-pubic, and superficial transverse perineum. So that means it is related to your obturator internus, which is a part of your pelvic diaphragm, and deep transverse perineum, which is your urogenital diaphragm, and your superficial transverse perineum. Those are your superficial perineal pouch. So let us see these things in your. You want me to write down here again? So your upper one is obturator internus, middle one is your deep transverse perineum, and the nerves which are related are your dorsal nerve of penis / clitoris and your internal pudendal vessels, and more lower down, which should be number 3. I am putting it down here due to lack of space. Crus penis / clitoris in female, ischio-pubic muscle. All these are your muscles of your superficial perineal pouch, and your superficial transverse perineum, and I told you there is a perineal membrane separating this. So let us see these things in the app. So let us put the muscle in the place now. First, what muscle we need now? We need obturator internus is there, deep transverse perineum. Deep transverse perineum muscle, yes. Now we need perineal membrane which separate these two. Perineal membrane, right. We also need superficial transverse perineum muscle, right. Okay, so we then ischio-cavernosus, right. Then crespinus, I doubt crespinus is there here, but let us put. So it is not there, I think. Not there. Okay. Then your nerves are there. Which nerve we need? Internal pudendal is already there. Dorsal nerve, we'll see. Dorsal nerve of penis, right. Okay. So one by one, let us see. So from above downward, obturator internus. So again I'll show you, this is our obturator internus. So isolate, and you can see the upper margin, it is attached, right. So then lower area, whatever the gap you're seeing below, from there the rest of the muscle will come. So let us go to the next muscle, and next is our deep transverse perineum. Beautiful, you can see from the top that small tiny muscle which is coming. Yeah, that one is your deep transverse perineum, very super small, like a pencil. You see how beautiful it is. So it is just this deep transverse perineum muscle coming, and deeper to that you see there is a white membrane, that is a perineal membrane. So isolate, and now you see that's a perineal membrane on the right side. Left side also will come from there. So above this is your deep transverse perineum or deep perineal pouch, and below will be your superficial perineal pouch. Beautiful. Okay, and then next muscle deeper to this, we should expect you see there is a muscle there. This muscle is here, this one. So this is your superficial transverse perineum. So I am curious to know, to separate multi-select, if I do, I want to see all three. Superficial, deep, where is this muscle? I think it is hidden. It is hidden it. So what I have to do? Undo. So one more muscle I have to bring. So one superficial, this deep, also deep. So if we isolate all three, now you see this is a beauty. So this is your superficial transverse perineum down, perineal membrane in between, and deep is on the top. And if you explode this, oh beautiful, assemble this. Okay, so that's just the happiness of a mad anatomist like me. Okay, so that is about your okay, so we are done with the obturator internus, deep transverse perineum. Now here we need a internal pudendal, that is already there. You see there is a vessel is there on the top. If I go there, you see, maybe if we can multi-select this thing also and this also, and let us isolate. Now you see this is the relationship. So I told you, along with the deep transverse perineum, you have here artery I didn't select. I think artery also will be running along with it. So that will be your internal pudendal artery, internal pudendal vein, and along with that there is a nerve. Is it? The nerve is your dorsal nerve. Okay. You can see that nerve which is coming in the front, that is the dorsal nerve of penis or clitoris. This one. Sorry, this is exit. I have to go. It is selecting all of it. Okay, now this one. Let us, as curiosity, see. So it is the branch coming from your internal pudendal, your pudendal nerve, dorsal nerve. Okay. So now we need your ischio-cavernosus. Yeah, that is a muscle there down. See this one? This is ischio-cavernosus muscle. You isolate. You see inside this. This is right side, and left side will be the ischio-cavernosus. See there, where it is arising. Can you see the lowermost margin of your inner surface of your conjoined ischio-pubic rami? And finally, superficial transverse perineum that I already showed you. So these are your perineal membrane also we have seen. So this finishes your entire story. So I think we have done considerable job. So if you want again and again, you can go through it. And if you have any question, guys, get back to me. In the next session, I'll do the pubis. So take care, guys.